was diagnosed in late January of 2021, and it all happened pretty quickly. It had started back in November of the previous year. I just felt a little abdominal pain, a little blood when I would go to the restroom, but I just thought it'll go away. It'll eventually be okay. And then one morning I woke up and went to the restroom, and it was just nothing but blood. And again, I thought that'll be okay. And then the rest of the day, probably 18 or 20 times, I was going to the bathroom, and it was nothing but blood. And about a week before that, when I first started to see the blood when I would go, I went to the ER and had the exams and the scans, and cancer wasn't mentioned once. It could be Crohn's disease, colitis. There's several different. And then after going to the bathroom all that day with blood, I went back to the ER again, and the doctor said, "You're not leaving without a colonoscopy." So I had the colonoscopy the next morning, and that's when the tumor was found. Well, I had, first of all, not been going to the doctor like I should have been. Had I been going to my primary care physician like I should have been, there may have been some tests, blood work, that would have shown that maybe this was coming, or maybe that, something wasn't right. So if I had have been doing that, I don't know if that would have made a difference. But it was young. I never thought to ask for a colon cancer screening. I wasn't even sure what all that entailed. It just wasn't something that was at the top of my mind, that of all the health issues I should be looking at, colon cancer certainly wasn't one of them. When I was going to the doctor, it was never mentioned about a colon cancer screening. It just wasn't a health issue that I was concerned about because I was so young. I'd had the colonoscopy, and even at that time I thought it's going to be okay. It's going to be something that's going to go away in a few days and be fixable. And after the colonoscopy, the doctor came out and he said, "We found a surprise." And he said, "There is a tumor, a pretty large tumor, but he said it's a soft tumor, so chances are it hasn't been there very long." And he said it's probably cancer, and that's the first time I'd ever heard the word cancer. And I just remember smiling at him and saying, "Okay." And he said, "We believe we can do surgery to remove the tumor." And I said, "If that doesn't work?" And he said, "Well, chemotherapy." But I didn't really have a reaction. I just think it was survival mode, and I remember smiling at him and saying, "Thank you. When can I go home?" So I didn't have, the reaction of, "Oh my goodness, this was cancer." I don't think I had processed it at that point. I don't think it really hit me that I'd been told I had cancer. About 6 or 7 months later, I think for so long, again, it's that survival mode. You just need to get through it. And because I'd had such severe bleeding and the tumor was quite large, I went home for a couple of days and then had surgery. So I really only knew I had cancer for about 4 days. It was in my body longer than that, but I didn't know that. So unlike so many people who have to live for so long knowing they have cancer, I thankfully wasn't. So for 4 days, I knew I had cancer. And then it was about 6 or 7 months later, after all the surgeries, and there was some complications with the surgery, so I was in the hospital for quite a while. And then, all the doctor's appointments, oncology appointments you go to after the fact. And it's more mental, I think, at this point than physical. But it was about 6 or 7 months later before I actually realized what I had been through, what I would still have to go through just as a precautionary. But it was months later before I ever really processed that I had cancer. Well, again, thankfully, the surgery removed the tumor, and it hadn't spread at that point. And I see my oncologist now every 6 months. But every little ache and pain and itch, you think it's cancer. And so I try to be a little more cautious now with my body, and when I feel like something might be wrong, I think you have to pay attention to that and go to the doctor. And I also want to make sure that other people, especially other young women, realize that talk to your doctor. First of all, go to the doctor. Find a primary care physician, go to the doctor, get your screenings, get your blood work, and talk to your doctor about a colonoscopy. Sometimes a family history, it doesn't necessarily matter. I didn't have a family history of colon cancer or cancer at all. So just talk to your doctor. I want to make sure people know that so many cancers, especially colon cancer, if it's caught early, it can be treatable. And I just want to make sure that people know that. I still am somewhat hesitant to talk about it because I feel like I've been very blessed. There's been women that I've either read about or maybe know who were diagnosed with colon cancer, and it wasn't caught as early as mine was. And they've had to go through the chemotherapy and they still have it. And so I feel a little hesitant to talk about it because I didn't have to go through what they have gone through. But I also know at any time it could come back because I'm still going to my appointments and I'm having colonoscopies, and polyps are still found in my colonoscopies. They're removed. Thankfully, they've all been precancerous, but as long as those polyps are found, I will have to continue to have the colonoscopies. So I've certainly talked to my mom and my sister. My mom has had a colonoscopy. Still working to get my sister there because the doctors have said that your siblings, especially your female siblings, if you've had colon cancer, need to be checked. But I'm becoming more comfortable talking about it because I feel like when we talk about it, then more people are comfortable talking about it and not as hesitant to pay attention to their bathroom habits and to body habits and changes in your body. And if your body changes and it goes on for 2 weeks or more, something might not be right. So I'm becoming more comfortable talking about it, but I'm just very blessed that it was caught as early as it was. You can get colon cancer. You don't have to have a family history of it. It can happen to you. Talk to your primary care physician, get a primary care physician, go to the doctor, get the screenings, get the blood work to check on yourself and make sure you're okay. Pay attention to your body. When you go to the bathroom, you shouldn't have lots of blood coming out of your body. You shouldn't have severe abdominal pain. So just pay attention to your body, and anybody can get colon cancer, and it can happen to anybody at any time. So just pay attention to yourself and go to the doctor. So much can be prevented and treatable if you will just go to the doctor and take care of yourself. And it can be scary sometimes, but it's worth it for that peace of mind. And it's great if you go and nothing's wrong. And if you go and something's found, at least you know, and at least it can be taken care of. So my best advice to anybody would be go to the doctor and ask your doctor about a colon cancer screening.